So to begin, I won't get too much into it. It was covered a little bit, but so I entered college as an undergrad, fairly traveled. So I lived in Yokohama when I was in the Navy. I traveled throughout Southeast Asia and Western Pacific. And in my travel, I was kind of interested in culture. I'm from a very tiny town in Iowa. It's about 500 people, and we have only gravel roads and no stoplights. And so it was quite something to move to Yokohama, which, if you don't know, is part of the Tokyo Metro, and it's about 40 million people. And so I was interested in that. So I went back to school, and I'm not sure. I wasn't really quite sure if anthropology was going to pan out. So I was also pre-med, and I didn't choose the biology or chemistry major like most people do because I wasn't sure if that would pan out either. So I was trying to cover my bases a bit. But so my first trip, kind of as an academic, I went to Guinea-Bissau, which is in West Africa, and I did some ethnography. And so I lived with a tribe in a little hut, and so they are animists, and so they would have a lot of religious ceremonies, and they would use palm wine when they talked to their ancestors. And so I was there. Palm wine is only collected by men in a certain forest, and so I got up every morning and went out and collected wine and sold it to farm workers, and took a nap, and then had some more wine in the afternoon. And but while I was there was a British medical station, and they were studying HIV too, which, if you may or may not know. So there's a lot of different strains of HIV, but there's also HIV-1 and HIV-2. HIV-2 tends to make people sicker later, and so it takes a little while. And so they were just doing basic research, and while I was there, in my kind of off time, I followed around the CHLWs, so the community health workers. And so I would get up and load up on some mopeds, and we would travel around and do some health surveys for some of the children. And then, I came back, I presented, I graduated, and then I knew that I needed to go to grad school. I wanted to go to grad school, but I was still kind of waffling between medical school and being a clinician and public health. And so I had kind of learned about public health while I was an undergrad, and I eventually ended up going that way. But I knew that grad school was a lot of homework, which you all know, and a lot of reading. And so it's very nice to have a job where, when you're done at the end of the day, you don't have to do homework. And so that's construction. And so I built some houses with AmeriCorps. And I just kind of joke, herding cats. So I was a construction site leader. And so every day we would get a whole group of, Methodist grandmas or college kids on spring break or something, and I would have to start every day with, this is a paintbrush or this is a hammer, and try to prevent chaos, and then every day you'd start over. And so it's actually a skill that's come in handy as a professional. So if you're thinking about taking a year to figure out what you want to do with your life, AmeriCorps is a good place to start. And then I came to UAB, and I did my field work. So you have to do an internship. So I did mine in Western Zambia. I was lucky to have UAB send me there, and I worked with Moses and Kala, who's since passed, but they have a Moses and Kala scholarship. So it's good to see that. And I traveled. I did 2 projects. I worked in Lusaka at the University Teaching Hospital. And I also did one out in the field in the Western Province, and we just traveled from village to village, and we did some focus groups, and I asked questions with some of the 15 to 20-year-old kids, and asked them questions like, what does somebody with HIV look like? Can you get it from this? Can you get it from that? And I remember that from when I was a kid, and so growing up in the 80s, that's when HIV kind of came about, or it really, really hit hard. And so I remember people were just freaking out, and they were pulling their kids out of schools and saying, people are spitting in the water fountains, and that's how you get it. And so some of that, in kind of the less populated areas, some of that misconception still lives. And so that's what I was studying. I came back, I presented. Luckily, in my second year here, I went to a small lecture where an alum had come, and she presented on the Presidential Management Fellow Program, which is this bottom bullet here in PMF. And so that is a fellowship that you can apply. They've changed it slightly. You had to apply it in the year that you graduated when I did it, but now I think it's up to 2 years after you can still apply. But it's for anyone with any graduate degree, and you can work basically anywhere in the government. So if you have a law degree, you want to work for the FBI, you can apply. If you have a public health degree and you want to work at CDC or NIH, you're free to apply. And so I just happened to show up that day because they had free sandwiches. And eventually, the following summer, which if you haven't applied to any government program, it takes months to go through, and it takes round after round of interviews. But eventually, I got a job. And so I left Birmingham and I went to CDC in Atlanta. I took the job kind of sight unseen. I didn't really know what I was going to be doing, and I was actually interviewing for a different position. And so one of the people who were sitting on the panel noticed that some of the stuff I had done here, like I did the case competitions, and so I had won, and I come in second, and those are good fun. I hope they still have them. We stayed up all night, and you change your topic at 4 a.m. the night before you present, and so that also prepared me for being a working professional. But so they saw that I was kind of a systems thinker, and I was comfortable with kind of these fuzzy questions. And so that was a need that they had at CDC for some time. And so they brought me on to kind of take that on. And that was a new role. They had not had that team. And so eventually, so the fellowship is 2 years. So I did it for 2 years. You have to do a development rotation, so 6 months outside of your chain of command. So I went to Swaziland, which is a tiny country in southern Africa. And when I told my parents, they said, "That's a real place." It's a real country. But I went there as the deputy director, and I learned mostly through failing. But it was kind of the same. You just show up and see what you can do and where you can help out best, and you learn a lot. And then eventually I came back. I became the team lead of the special response team. We took on a lot of these one-off projects. We would do a lot of kind of fast prototyping, come up with a solution, give it a shot. If it didn't work, we would adjust. If it did work, we would fix the pieces that didn't. And then eventually the goal was to kind of send it off. You can't have a job where you just take on more and more projects, or you're just going to run out of people. So luckily not every day was a crisis and we were trying to fix something. So I had to have kind of a full-time job also, and that was I worked with the WHO HIV department in UNAIDS in Geneva. And so it says I'm the focal point for multilateral partnerships. It's very governmental speak, but what that means is for these global HIV programs, there's health system strengthening, there's mother and child prevention, there's all of this. And I'm not a lab expert, I'm not an expert in any of those. So I was the focal point, and I, again, was herding cats and making sure that people were signing papers and making their technical guidance was finished before we published. And so my specialty became kind of translating U.S. government to the UN system, and the UN system translating to CDC. So CDC is a domestic agency, and I'm sure everyone knows it's in Atlanta because it started with the malaria program post-World War II. But because it's a domestic agency, they have very specific rules on how they operate. And the UN system is a multilateral, so many countries buy into it, and it's a global agency or a global organization. And so those don't jive a lot of times. And so I had to figure out how to translate back and forth. And so eventually I left CDC, and this is a pretty recent move. So I went to Washington, D.C. To work in the Office of Global Affairs, which is global health diplomacy. And so while I was there, you work under the Secretary of Health and Human Services and various deputy assistant secretaries, and they have them broken apart by kind of a specialty or operating area. And I backfilled in the offices of Europe, Eurasia, and Asia Pacific, and so there's a lot of, if you think about Asia Pacific, there's a lot of global health security issues. There's a lot of pandemic flu and I don't know, there's a lot of stuff. And so also intellectual property, which I knew nothing about until I got there, but that's when, say, Pfizer or some organization makes a new medicine, and then in Brazil or India, they decide that they're going to take that medicine and make it themselves for much cheaper, which if you're a clinician, it's great because you can treat people for hardly any money. If you're a U.S. organization, there's laws against that. You can't steal other people's intellectual property. And so I worked with lawyers and had lots of interesting meetings. And same with air pollution in India. The air is, so we had a conference in India, and while the conference was going on, the air was so polluted and it was so hot, it was dangerous to go outside. And so if you're going to look at an issue, it was actually a perfect demonstration of why this needed to be addressed. And then we would have ministers from countries like Singapore or Poland, Australia, who are having kind of aging populations, and they want to figure out how are they going to take care of their elderly. And they would look at us because we have Medicaid and we have Medicare and we have systems in place. And so I was there for the election, and it was interesting because the day after the election, a new administration comes in and you start from scratch. And so there was a lot of questions that we got the day after that we weren't able to answer. But that's part of global health diplomacy, as you say, this is the U.S. position on this, and we're going to continue until we don't. And so I left there. OGA was a good place to be, but that's not where my skill set lies. And so I went back to work in PEPFAR at HRSA, which, if you've not heard of it, HRSA is a smaller agency still under the HHS umbrella, but they manage the Ryan White program, which is the domestic HIV program. They also address kind of underserved areas in the United States. And so they have a large HIV/AIDS bureau, but because they're the health system strengthening experts and the human resources for health people, the nursing program people, they also manage that for PEPFAR. And so PEPFAR is through the State Department, and so it's basically like a big bucket of money that gets split out between CDC, who are very good at labs and testing, and DOD, who does a certain thing, and commerce across the board. And so HRSA has that one little piece, and so that's where I am now. And then for the Malawi, every country that we work in has to have somebody who's in charge or just overseeing all of the different programs. And so it's on you to understand the political climate and the epidemic and funding issues and who's doing what and who's not doing what when they should be. And so that's kind of what I do now. And it's a very interesting role. It's a lot different than the role I had at CDC, but it's a good opportunity, and I'll kind of get into that too. Sometimes you just have to see an opportunity and go for it, and so the timing was right for me. And so working in government health, when I was a student here, I didn't really know, what does the CDC do? I took a job and I had not met anybody at the CDC, and I wasn't really sure if it was a good thing, if it was a bad thing, if I wanted to be working in the field. Does CDC do that? And so part of this conversation is me just to give you the 30,000-foot view, and if you have any questions, please jump in. But so working for a government agency differs in that government agencies tend to be the donor organizations, and so if you were to look at the kind of the staffing, you have a lot of younger folks or a lot of early career people who kind of make the spreadsheets, and they just kind of do the work. They're the worker bees. And then you have people who are experts who have been in the field for 20 or 40 years, and their job is to kind of house organizational knowledge. And so government agencies they tend to put out reports. They set guidelines. They convene to talk about vaccinations with children. If you should, if you're 2 or 4, or for HIV, a lot of it has to do with medicines. And so, is it okay to take medicines every day, or how do you double? If your bottleneck is the pharmacy, how do you double the number of people that one pharmacy can serve in a given month? And so we have to meet with somebody who's an expert in the medicine. You meet with somebody who's an expert in pharmacy, and you come up with strategies of, well, you can prescribe them 2 months worth of medicine instead of 1, and they'll still be adherent, which is a huge issue with HIV. And so the international organizations, they tend to serve a similar type of role, but so the UN is nearly 200 member countries, and I have a very messy chart buried deep in my slides, but the only purpose was to show you how messy it is. And so it's some global health diplomacy, but also they do the same, where not everyone is the most friendly or maybe most receptive to U.S. guidance. And so we have a lot of good scientists on our side, but we also have a lot of good scientists in the UK and China. And so you make joint guidelines. And so if it has the WHO stamp of approval, then it tends to be taken up globally instead of just selected. And so the nonprofits, NGOs, another type of organization, and that's so they tend to be the implementers. And so up to now, I haven't really said that there's people who are in the field and giving pills to children and that type of thing. And so there is some of that, but in general, we donor agencies tend to give money through grants, through different mechanisms to organizations who will do work, they'll do studies, they'll do something, and it's a very defined product or service that they fill, and we'll do that. Otherwise, we would have to have tens of thousands of people on staff to go to every country and work, and so that's that. And then you have schools of public health, which you all know. But the schools of public health can also implement. They can also get grant money to do research. They can get private money to research. They teach the next generation. They manage projects, coordinate programs. And then you have corporations who, their motives are slightly different. If you work for the government, you're not trying to make a profit. But if you work for Coca-Cola, you can't survive unless you make money. But organizations like that, they do good work. And so when I was in Swaziland, the number one export for that country is soft drink additives. And so they grow sugar. It's a very water-intensive endeavor. And so Coca-Cola is there, and they kind of pilot and test their own water-saving measures or how to recycle water to make sure that it's palatable or potable. Or if you work for a pharmaceutical corporation, you may develop medicines or technology to use by a lower middle income country. And so that's, in general, that's global health. It's a giant juggernaut. No one can do everything. Everybody has kind of fallen into their specialty. And so this is a messy diagram that I'm showing mostly as just an example. And so kind of one of the ways to understand how things work is to follow the money. And so for PEPFAR, we get money from Congress. It gets split to OGAC, which is the Office of the Global AIDS Coordinator at the State Department. They get the majority of it. Then there's also this smaller arrow where some agencies get money directly. And it gets broken apart, and this is where I said, Peace Corps does a certain thing, Commerce, everyone has their specialty, and so they manage programs that fall in that wheelhouse. And then out of that, they have grants, cooperative agreements, studies, whatever. And so they give it to the agency headquarters and the field offices. who then in turn give it to the partners. And so it's these prime partners, implementing partners who are doing the work. They report back to the managers, and then eventually we have to report back to Congress every year. And so PEPFAR just released their 2017 report to Congress, which is, I forget, maybe 200 pages, something like that, but it's kind of A to Z on what we do, where we do it, strategies, successes, failings, and so, yeah. So anyway, I put that up there simply just to help kind of drive home who does what, and it's a bureaucracy, it's the government. So, and so how do you get a job? I think everyone wants a job eventually, and so to get a job, you can take several different paths. So Peace Corps, AmeriCorps, that's a very easy, well, it's not an easy job, but it's a very kind of direct pathway where you tend to work in the field, in the communities. You kind of oversee projects. You may get some funding. You may develop your own project and then have it implemented. There are some benefits to doing it that way, where it's you get paid. Some places you go and you're an intern or a volunteer and you get paid zero. These you tend to get paid local wages, which is not a lot, but you can buy beans and you'll get by, and it gives you a little bit of an appreciation of the communities that you're working. It also counts towards your time in service. So if you want to retire someday, which is nice, depending on which program you're in, those years will add on to your retirement. Same with hiring preferences, and it's just trying to navigate through the U.S. government hiring system. Can be a little bit of a challenge, and so if you have a hiring preference, which it doesn't mean that you're guaranteed a job, but if you were to have an extra 5 points tacked on, and if you're rated on 1 to 100 and you score an 80, it may bump you up to an 85, and that may be enough to get a job. And so there's also the Foreign Service, and so there's different types of Foreign Service. I just have 2 here, but so the most people think of Foreign Service as the State Department people, so the people who work at the embassies, ambassadors, and so they may be the political officer, the economic officer, but also they issue passports. But there's also Foreign Service in USAID, which is the Agency for International Development, and they have public health programs. They do agricultural programs. We also have the USDA, so U.S. Department of Agriculture. They have some folks who work in the Foreign Service also, and they're the ones who work with, like in some famine instances, they may send some people in to help either try to rehab some of the crops or provide emergency aid, but they're already on the ground. They kind of work in the community, so they're the first folks there. And then there's fellowships. So government fellowships, so PMF program, I already said, that's what I came in as. So there's a Global Health Fellows program, which is a USAID program. There's Fogarty and PHAP and EIS, and if it's a government agency, it's going to have 100 acronyms, and you have to learn the jargon. But you can Google any of those initials, and it'll point you in the right direction. And then there's some non-governmental fellowships. So Global Health Corps is an organization. ASPPH, which is the Association for Public. There you go. And then ORISE, which is also an acronym, but it is a good way if you have either a policy or a science background. You may want to look into that. Those are funded through a different mechanism, so you're not technically an employee, you're a fellow, but you get put on projects where you may be a data analyst or doing some GIS modeling or helping write legislation or something. So, and then again, there's more NGOs, contractors, consultants. So most of the organizations are located where the agencies are. And so I worked at CDC. There's a few in Atlanta. I work in DC area now, so there's a lot more in DC. But they're not only there. And most of them, most likely coming out of here, whether you're an undergrad or a grad student, you'll start off at an associate level, which is just the entry level. And you come out of school with great knowledge. You know how epidemics flow. You know why people get sick. You know why people don't follow instructions when it's printed on the label. But you don't actually know how to do anything. And so, that's what you learn when you're there. So you kind of translate, academic knowledge into practice. And so that's what associates do. And then you work your way up. And then internships, I'm sure everybody's familiar with internships, but it's a good way to gain experience. Ideally everybody wants to be told, oh, you did an awesome job and we're just going to continue to pay you to do what you were doing. But you should do them anyway, because every experience builds on each other. And so, if you could do more than one, I would suggest you do more than one, because you're going to get something out of it, even if it's cleaning data in a data set. Making sure all your A's are capital A's or something. It can be very mind-numbing, but you definitely learn. So the more that you learn, the better prepared you are for working. And so for the jobs, where are they? So you can volunteer overseas, Peace Corps, others. Also Washington, D.C., which I said. So Seattle, there's some foundations in Seattle, the Gates Foundation, PATH, there's a few others. They're there. And so New York, Boston Research Triangle, which is not all that far from here, but it's a little bit overlooked, I think. And they have a lot of good organizations that work there. And then, any sort of university with a global health program, if you want to do global health work, sometimes they have, something that you can get hired to do. And so, where do you find them? So you have to Google. Use the Google, and so. But there's different organizations or websites that are good places to go, and they kind of consolidate jobs. Or you can just go and see who's posting jobs, which is what I did, and then look at that company or look at that organization to see what they do, and just kind of become knowledgeable. Because if you are lucky enough to get called in to interview, it's good to know what the people who want to hire you actually do. Otherwise, you may be hugely disappointed when you get there. But and these, I'm going to share the slides, and so you can write them down, or you can get them later. And I have some kind of general tips for new graduates. Learning doesn't stop when you finish school. I think it really just kind of begins, and you have to commit to a career of constant learning. And so especially learning or working in global HIV, everything changes every year. When I was a kid, there was no medicine, and so it was behavioral interventions, prevention measures. Now there's medicine that you can take, and how it works is if you have a lot of virus in your blood, you can transmit the disease. If you take medicine and you're adherent, which means you take it often, if it's successful, it'll knock the virus down to zero or to undetectable. And so that means not only are you healthier, you have a much less risk of passing on to other people. And so, that tends to change. The medicines change. The cost of the medicines change, so the size of the population that you serve can change, and so on. And so you constantly have to learn, and it's a lot. And so, not all of them are research papers, but learn how to read them, because you continue to do that kind of throughout your career. And then follow opportunities where they come. You can very easily get pigeonholed of, well, they're a nurse, so they only do nursing things, but you may be interested in economics, or you may be interested in something. And so as you learn and as you grow in your career, don't be afraid to kind of jump into a direction that you weren't really sure that you would have gone at the start. And then don't limit yourself to work overseas only. There's a lot of unmet need in the Southeast. There's a lot of good stuff that you can do here. The advantage is you're already here. There's a lot of opportunity. You don't have to have these giant research grants to go out and start your own organization. You can fund drive, you can do whatever you need to do, and you can do it here, and those skills aren't going to go away. You'll only build on them. And you may decide that that you want to work in Birmingham and not in Malawi. You just go where you feel engaged. Learn a language. So again, it's something that's as you are trying to get a job and make yourself more marketable, if you know another language or two or more, you take the basic skill set that you have. So if you're a great data analyst and you can do it in 3 different languages, you're a huge asset to the organization. It doesn't mean that if you only speak one, you're at a handicap, but you just try to make yourself the best acquisition or the hire that any organization can do. And then don't worry about finding a forever home on your first try. A lot of people say, well, I'm not really sure if I want to work for the government. I don't want to work for a pharmaceutical company. You don't know until you get there, but also you're not going to run the company. You're not going to. Few people work for the same place for 40 years, and so just go in, give it a shot. Either you like it or you don't. You learn something, and you just continue on. But don't worry about they're new. I'm not really sure if they're going to be here in the long run. Just if it's a job and you think that you can be a value added to the organization, I'd say definitely go for it. And do we have any undergrads? Raise your hand. No. Nice. Since everybody's a grad student, you learned eventually you're going to have to ask for a reference. And so it's a little bit shocking to people who kind of muddle through and get their bachelor's degree, and then 5 years later they want to go to grad school. And it's hard to call up a professor and say, hey, remember me? I took that course. I wrote a paper. I got a B. They don't know who you are. And so talk to them now. And also they're professionals in their field, and so they have a lot of interesting experience and stories. And so just talk to them genuinely. Don't try to think if I talk to them I'll get some sort of awesome internship. Maybe, but it's also just good to know plurality of thought on some sort of topic. And then don't see your peers as competition. It's a little bit hard. So I tend to be a competitive person, but not to other people. Like, I'm competitive inside. So if I get a test and it has a 95 or something, I want to know why I didn't get 100. It's okay to be that way, I think. If I was more concerned with I got a 95 and they got a 97, and they're going to get a job before I do, which happens sometimes. Just don't be that way. That's some unsolicited advice. And then actually get to know people. So a smaller connected network, as you're looking for a job, or even when you're just in your career, if you know 15 people really well, and they're spread kind of throughout the country or throughout your organization, those 15 people, they're much more likely to send you an email and either invite you to work on a project or to send a job your way, than if you know 300 people and they're your LinkedIn contact or your Facebook friends, and you know next to nothing about them. And so, just don't email when you want something. You don't have to be writing letters. It can just be, it's your birthday, happy, or I saw this thing on TV the other day, it made me think of your project, I hope you're well. And that, is kind of nice. And it's much less awkward to contact somebody if you tend to do that than 3 years later if you're like, hey, I see you work here, I would like to work there also. And then stay connected with universities. That's something that I don't know that I truly valued both as an undergrad and as a grad student until after. And so, I went to Missouri State as an undergrad, and we have a 100,000 alumni nationwide. I'm not sure what UAB's alumni network looks like. But it's good to be connected. If you're not connected, you're just numbers, and then you're just some UAB grad that works somewhere. When you leave, you stay connected to your network. Mina may reach out to you and say, hey, would you like to come back to campus and meet some kids and talk about what you do. If you stay connected to your university, you kind of add value to that organization. And so universities networks value is the value that it adds, and so it allows you to move into different areas. And so if you move to Washington, D.C., there's somebody here that can probably put you in touch with somebody else, and it just gives you maybe a friendly face, but also you're not starting from scratch every time you move somewhere. And then, give time and money. When you graduate, UAB will ask you for money. That's not the only thing the Alumni Association does, but they will do that. And it's really tough, especially when you're early in your career, to want to give money. But I was a student, and they paid for me to go to Zambia and do research, and they paid for sandwiches, and so give them some money, and and then be a champion for UAB. Again, UAB is, the classes are smaller than maybe some of the other the public health schools, and I worked at CDC. Emory University is right next door, and it's an amazing school. But there's Emory people everywhere, and you don't really know who from UAB is there unless you tell somebody or somebody tells you. And so don't forget, just wave the UAB flag from time to time. And for me, I work in HIV. Learn about HIV/AIDS. It's an amazing thing that has happened over the last 30 or 40 years. From the early epidemic to the social stigma and all of the uprisings, and then all of the civil society organizations that spoke up and learned, they're the reason why agendas change. Change is hard, especially if you're an elected politician or if you're a senior level somebody in the government. And so having people follow you around and continue to ask you why you're not doing this, or learning the science and question you at conferences, it forces positive change. And so me as a government employee, I'm advocating for you to just learn all of that and why we are where we are. And it's an amazing story. And so, I think you should just look it up. There's good stuff on Netflix and CNN, and I don't need to point you in the right direction. There's also bad stuff, so use your best judgment. You're educated people. And then global HIV program, it needs people. It needs scientists and clinicians, behavioral people, economists, data scientists, logisticians. I had Frank Franklin. Is he still around here? He said, when he was young, they said, follow this disease if you want to learn about medicine and learn about people. And so I would say the same for HIV. You can. I work on. I'm on some economics work groups, so I do not have an economics background, but I learned it because it was interesting, and also there was a need there, and just continue to learn. And if you're interested, there's a place, and I don't know if it's with any specific organization or it'll be working with me, but there'll be a place for you. And then there's some self-plugging, some websites. PEPFAR.gov is the Global AIDS Ambassador website. You can find whatever you want. We have an open data initiative, so you can find funding and epidemiological data and whatever you want to know. 3.0, PEPFAR 3.0 is our strategy document. It lays out as concisely as you can for a global program, kind of the direction that we want to go. And so we had the report to Congress, and then UNAIDS, I worked with them. So they have, similar to the PEPFAR 3.0 strategy, which is, if you were to sum it up, and it's repeated often, it was do the right thing at the right time in the right place. And so go where the epidemic is, do your intervention, do it at the correct time. Before, when it was just largely emergency response, we didn't have data systems in place, and so you would go to some country, some giant country like Nigeria, which has a lot of people, but you don't know who has HIV, you don't know where the need is, and so you kind of blanket fund. And so as we've done the response, and is PEPFAR, then PEPFAR 2.0, now 3.0, we've come up with systems in place to measure epidemics, to come up with better interventions, and it's bending the curve. And so before, it was always just this upward trend. People are going to have HIV, and eventually you're going to get AIDS, and you're going to die. But that's not the case anymore. And so UNAIDS is the joint UN program for HIV/AIDS, and they leverage across 10 organizations in the UN. And so it's labor, it's science, it's this, and we've helped model the 90-90-90 strategy. Again, you can look that up too, but essentially it's 90% of the people get tested, 90% of the people know their status, and 90% of the people get or get on treatment and then have their viral load suppressed, which makes them less infectious. And so if you do that, eventually, the upward slope of the epidemic will not continue. And I have some slides on that. It's actually pretty interesting in that we're in this 5-year window that if you go to the right place and you do the right thing and you focus as much money as we can. So global budgets, HIV budgets have flatlined over the last 6 or so years. And so we have enough momentum now that we can turn the epidemic curve down. But if we miss this window, you have to assume that we're not going to have enough funding, but the epidemic basically is out of control, and we can't. And so we're in this very pivotal window. And so so PEPFAR or UNAIDS is the kind of the global advocate for HIV response too. So I would encourage you to go look at their website and their materials.